Hey, what's up guys? This is Dr. Devin Shea from Aligned Life, and today I'm going to talk to you all about dizziness and vertigo, and I'm going to give you 3 powerful treatment options that are going to be highly effective in improving your symptoms. Let's get it going. All right, so underneath the umbrella of dizziness, we've got 2 types. We've got peripheral causes and we have central causes. Central causes are all the stuff we don't want to have. This is things like tumors, brainstem problems, cerebellum problems, the part of the brain that's responsible for coordination and movement, problems in your brain. We're not going to talk about those today. We're going to talk about peripheral causes and how to be able to manage some of those. So the peripheral causes that we see, they have everything to do with how you relate to your environment. So we pick up cues from our environment about where our body is in space from 3 things. Number 1, from our ears, especially our inner ear. The inner ear isn't this, they call it the pinna, which is this big part on the outside that we see, but the actual part that takes place inside the skull, the inner ear. That's number 1. Number 2, we have our eyes to actually pick up where our bodies are in space. And then number 3, we have our body position awareness. See, and this is termed proprioception. Your body gets information from all the joints of your body. And when those joints are working well, the information is sent from the joint up to the brain so the brain can control that joint and understand where it is in space. So when your inner ear, your eyes, and your proprioceptors are all working really well, then you have the ability today to coordinate movement really well. We can stay balanced. We typically don't feel the sensation of dizziness. All right, so when we talk about the 3 types of feelings associated with dizziness, we have first, lightheadedness. So lightheadedness is almost like if you're about to pass out or you're going to faint. Essentially, we're not getting enough blood flow into our brain, and accordingly, the body is going to prioritize, hey, you need to be laying down to protect yourself. So either sit down or lay down. We need to get brain blood as soon as possible. So that would be type 1. Number 2 is going to be this idea of disequilibrium. Disequilibrium means my brain and body aren't perceiving one another very well. It's almost like I've got a disconnect between brain and body. I oftentimes feel like I'm clumsy. I can't feel where I am in space. That's going to be type 2. Typically, this is because we have poor proprioception. And then type 3 is going to be really what we're going to tackle today, which is this idea of vertigo. Vertigo means that your environment around you is spinning. So a lot of times patients will tell me, doc, it feels like the room is spinning around me and I can't get under control. It almost feels like I've had too much to drink or something of that nature, right? So the most common type of vertigo is a big long word or a big long phrase, benign paroxysmal positional vertigo, or what's typically known as BPPV, because it's just way easier to say. So BPPV is another way of saying we have a benign, meaning a non-cancerous type of problem, but it's all associated with the positions of our body and where we are in space, leading to the room spinning, right? If you break down that phrase, that's exactly what it means. So how does this happen? If we look at the anatomy, inside the inner ear, vertigo is caused by a couple of pieces. So inside the inner ear, we have fluid. Fluid moves around as we move our body, especially our head, and that lets our brain know where we are in space based upon where that fluid is and how it contacts small little bits of hair inside that inner ear. Those inner ear hairs are almost like sensors. They let us know where we're at in space. So unfortunately in BPPV, we end up with some crystals getting inside. I know crystals, it sounds crazy, but this is literally what goes on. Crystals inside that inner ear section. And the crystals unfortunately run into the hairs and errantly fire off that sensor, which if you're going through your day and all of a sudden, let's say you go from sit to stand, and now you're getting weird firing patterns of where your body is in space. Now we get that sensation that the room is just flying around us, and we feel the sensation of vertigo. So I'm going to show you guys in just a second a few things that we can do to be able to work on this, and that'll help you to be able to try to get some of those crystals out of the ear and be able to have that normal fluid movement take place so that you can feel much better. So just before we jump in and start talking about treatment options, I want to make sure that you've gone through a checklist of things that could also potentially lead to the dizziness symptom that you may be experiencing. So first things first is fatigue. The second one would be if you've gone swimming lately. Sometimes just water in the ear would create an issue. I would also have you think about if you've had alcohol lately. Prescribed or not prescribed drugs can also lead to dizziness. I think fatigue is a major factor when it comes to dizziness. So if you've experienced any of these things, then that may give you a clue as to how you would go about treating the symptom of dizziness. All right, so let's talk about treatment options. First option that I would recommend that I've seen very effective in my practice is using what's called a chiropractic adjustment in order to be able to improve, if not eliminate entirely, the symptom of dizziness and vertigo. So a chiropractic adjustment is a way for a chiropractor to improve the alignment and function of the spine in an attempt to influence the way that your nervous system works. So earlier in our video today, we talked about this idea of proprioception, which is your body's position awareness sense, right? It's almost like your sixth sense. It's how, even if my eyes are closed, I still know where my body is in space at all times because I'm getting information from each of these proprioceptors in my joints, and it's being sent up to my brain, especially my cerebellum, where I can then control that movement and know where I'm at, okay? Now, the way that this works is if you have full range of motion, let's just use my wrist as an example, but any joint in the body, including the spine, also falls under the same principles, okay? But for the sake of this video, let's just use my wrist. If my wrist moves through a full range of motion, I'm getting the maximum information from this wrist joint up to my brain. So my brain can perceive and quote unquote see this joint very clearly and can control it and know where it is in space. However, when we have joints of the body that become misaligned or shifted out of their healthy position, in chiropractic we call this a subluxation. We'll notice that one of the most common symptoms associated with subluxation is we get loss of range of motion. So instead of having full range, let's say I've fallen on this wrist, I've misaligned it, and now the joint itself only moves a limited amount. We call that range of motion loss. That range of motion loss also reduces the volume and the quality of the information that I get from this wrist joint up to my brain and cerebellum. Which means if when I have full range of motion, I have great quality, great information, and therefore great insight about where my joint is in space, this lack of movement leads to lowered quality, lowered information going from this joint to my brain. So it's almost like I'm seeing this joint, but it's almost like through a set of foggy glasses, if you will. And that foggy sensation leads to that symptom of disequilibrium that we spoke of earlier in the video, where it's almost like my brain and body aren't connected. So by providing a chiropractic adjustment to be able to restore the alignment of the joint and accordingly restore the range of motion, now we impact how well this joint sends the proprioception from the joint to the brain, and I'm now reconnected. So that would be treatment option number one. Go into your chiropractic office, let them know where your symptom is associated. Or if you don't have any other symptoms associated with things like pain or range of motion loss, a lot of times people, especially with dizziness, they'll talk about that their neck is very stiff, like they can move well to one side, but then their range to the other side is very short. Or, they go and they try to move and their entire range of motion, everything is very limited and restricted. That's a big clue that a chiropractor would probably be able to be successful in restoring, the alignment of the spine and accordingly get that dizziness symptom to resolve. That's treatment option number one. Treatment option number two is an eye-based movement. This is something that you can try really from the comfort of your home. What we're going to do is we're going to go ahead and move our eyes side to side. So we're going to look left and right. We just want to go in a nice fluid movement. And we're going to do this 5 times in either direction. And then we're going to switch and then we're going to go ahead and go upward and down 5 times. And then we're going to go in a diagonal. So from the corner down low to the top and back and forth 5 times. You get the idea. And then from the opposite corner to the opposite side. And through this repetition, again, we talked about the eye being one of the peripheral ways that the body and the brain connect one another and where they are in space. This helps to reprogram that, get your brain and body to reconnect, get your visual fields working well, and improve the way that that functions. So that would be treatment option number 2. You would want to perform those exercises twice a day, and I'd recommend trying to go through 5 progressions of each of the different movements, side to side, up and down, and then diagonal. Go through that twice a day, working on that consistently. I'd recommend doing that for a week to 2 weeks to start seeing some improvement in that respect. All right. Third option in this respect is another eye movement. What we're going to do is we're going to leave our head directly neutral. I'm going to leave my eye focus directly neutral, but I'm going to move my head. So I'm going to keep my eyes looking, in this case, right at the camera, but I'm going to move my head side to side, kind of like I'm looking pretty creepy. But you get the idea. So I'm going to be continually looking focused forward. My eyes are going to be tracking. This tracking is really important because sometimes when we have some of these dizziness symptoms, we will get the eyes to flutter a little bit, and that flutter is a symptom of what we see with this issue. Okay, guys, last treatment option is a home-based therapy with the goal of attempting to be able to take some of those crystals in the ear that may be leading to the vertigo symptom, try to get them out of there. And this is something that you can do at home. The hard part with this is, unfortunately, you will experience an increase in your symptoms for a period of time while you attempt to treat this area. So please, if you feel nauseous, make sure you've got something next to you that you could potentially throw up in. I would not do this right before you needed to go and do a job or be with your children or something of that nature. Just use your best judgment in that respect. So what we're going to do is we're going to go ahead and I'm going to turn my head to a 45-degree angle. So not 90, and I'm not going to be straight ahead. I'm going to be at a 45. And then what I'm going to do is I'm going to lay down on my side. So I'm going to slide over here. I'm going to turn my head at a 45, and I'm going to lay down, and I'm going to bring my feet up onto the couch in this case, and I'm going to keep my head in that 45-degree plane. This will oftentimes lead to a very large expression of your vertigo symptoms. So I want you to hang out in this position until the symptom improves. After it improves, I would even wait another 10 or 30 seconds. Just give your body some time. Then what we're going to do is we're going to go ahead and sit back up in the head in the same position, and then we're going to come back to neutral. Oftentimes, sitting back up will lead to more symptoms. So I want you to hang out there, get to a place of comfort so that your symptoms improve. Then we're going to go and we're going to turn our head to the opposite side at a 45. And then we're going to lay down to the other side of the couch. So you're always going to turn your head away from the side that you're going to lay down towards. So if I'm going to lay down to my right side, I'm going to turn my head to the left, and then the converse on the other side. So your goal is to accumulate 5 repetitions of this entire process, right, center, and left. Do that 5 times, and you'll want to do that twice a day. Typically 4 to 7 days is about what you would need in order to be able to see improvement with this. So guys, I'm hoping that not only helping you to understand where this symptom of vertigo and dizziness comes from, but also being able to give you a few treatment options like chiropractic adjustments, the eye movements, and this movement that we just talked about here is going to really be able to help get your symptoms under control. If you've liked our video, please make sure that you give us a thumbs up. Please subscribe to our channel. And if there's someone in your life that has vertigo, please send that off to them. Make sure you share it with them. Thanks so much for watching. We'll see you guys next time.